This device is called the Incentive Spirometer or hyperinflation therapy. It looks something like this. They have multiple different designs. This one, if you look, it has keep indicator between arrows, and this is your indicator. It's what I call a float. Some of them will have good, better, best, meaning the slower you breathe in, the better it is. What this is designed to do is to help to reinflate the lungs. If you've had a patient that has had surgery, especially abdominal or chest surgery, it hurts to breathe deep. So what we need to do is try to give the patient an incentive to breathe through the pain. Some of the things that they can do is take a pillow and hug in. It's called splinting. It will actually help the patient to breathe deep. If they've had abdominal surgery, they can hug the pillow. A lot of times, like open heart surgery, where they have put an incision in the chest, split the sternum, they can hold the pillow here and then breathe in. It will help. Broken ribs, whatever it is, especially chest or abdominal, the risk of atelectasis and thus leading to pneumonia is very high, because when it hurts, the patient breathes shallow. They just breathe more often. So the device will look something like this. Has a mouthpiece, has all that. What I've done is I have one here with my filter on it so that you can do this. You just need an adapter for this one because it doesn't fit directly onto the hose. You have the patient do a normal exhalation. You don't want them going blowing out all the air, because then they're going to get very good numbers. In the package there is a graph. You find out their age, their gender, and that will tell you what level they should do. With this one, if the level said 1,000, then I may set it at 1,000. If the patient can only get 500, you may want to move it down to just above 500, and whatever they get, I always move it up just a little to try to push them to get a little higher. So with this one, they just exhale normally, put it in their mouth, and then breathe in while keeping the float between the arrows. I'm going to turn this around so that you can see it. Now, normal exhalation. If you notice at the end of the breath, I held it for a couple seconds, and that's to help get the air to distribute and pop the alveoli back open. This one is a little small for me. It's a 2500 cc. They make them up to 5000 cc's. That one would be the one that I truly need. But the technique is the same. If this is all you have, you just have them get it all the way up and then see how long they can hold it up there. This plunger is dependent upon flow. If they stop breathing or sucking in, it goes down. What you do not want them to do is this. You're not getting the full effect. You want a slow, deep inhalation. The float stays between the arrows. It's a slow, deep, hold it. They should do this about 10 times an hour. The problem is, people will say, I do it and I get lightheaded. What they're doing is they're picking it up and doing 10 in a row. They may be hyperventilating. Sometimes good advice, or not good advice, but I sometimes will tell my patients, say, hey, every time a commercial comes on the television, pick it up and do 3. They'll be getting about 12 to 15 per hour. I also tell the family members that are sitting there, you need to do this, remind them to do this. And I explain why. Because the air sacs in the lungs tend to collapse when you don't breathe as deep. If they collapse, you're at risk for pneumonia. You get pneumonia, you get to stay here with us. Personally, I don't want you here. The longer you're here, the more work I have to do. So it's a joke, they laugh, and I said, I want to get you home. I don't like working. So they laugh and try to have fun with the patients, but overall, what we're trying to do is to prevent atelectasis, which will help prevent pneumonia. So again, real quick, normal exhalation. and that is this is called an incentive spirometer. The incentive spirometer, it is with the hyperinflation therapy.